Describe the structural differences between the avian and mammalian respiratory systems. Why do birds have a more efficient gas exchange system compared to mammals? Answer. The avian respiratory system is uniquely designed to support the high metabolic demands of flight. Unlike mammals, birds have unidirectional airflow and air sacs that act as reservoirs, ensuring a continuous flow of air through the lungs. This unidirectional flow prevents stale air from mixing with fresh air, maximizing oxygen extraction. Mammals, by contrast, have bidirectional flow where air is inhaled and exhaled through the same passage. Birds also have parabronchi instead of alveoli where gas exchange occurs. This structure allows for a cross-current exchange system, which is more efficient than the tidal flow of mammalian alveoli. The rigidity of bird lungs ensures that air moves through the lungs without expanding or contracting, optimizing airflow during both inspiration and expiration. In mammals, air stagnates more in the lungs, reducing the overall efficiency of gas exchange. This makes the bird's system far more efficient at delivering oxygen to the bloodstream, especially necessary during flight when oxygen demands are elevated. What are the primary signs of stress in cats, and how can a veterinary technician mitigate these during a clinical examination? Answer. Cats under stress often exhibit specific signs such as hiding, piloerection, raised fur, flattened ears, and wide pupils. They may also display aggressive behavior such as hissing or growling and may become vocally excessive. Rapid breathing and dilated pupils are common signs of fear or discomfort. To mitigate these stress responses during an examination, veterinary technicians can take several steps. Create a calm environment by reducing noise and activity in the clinic. Use feline pheromone sprays, which can help create a calming atmosphere. Gentle handling, such as wrapping the cat in a towel or using a cat burrito technique, can minimize panic. Slow, gentle movements and minimal restraint should be used to avoid triggering the cat's fight or flight response. Treats or positive reinforcement can be given if the cat remains calm during procedures. Creating a calm atmosphere and reducing stress can not only improve the cat's experience, but also reduce the risk of injury to both the animal and veterinary staff. Mrs. Patel brings her golden retriever, Max, to the clinic. Max has a history of coughing and exercise intolerance. Auscultation reveals crackles in the lungs, and an echocardiogram indicates an enlarged left atrium. Based on Max's symptoms and diagnostic findings, what is the likely diagnosis? Explain the pathophysiology and treatment options. Answer. Max's symptoms, including coughing, exercise intolerance, and the crackles in the lungs, suggest left-sided congestive heart failure, CHF. The enlarged left atrium is indicative of volume overload in the left heart, which causes pulmonary edema and fluid buildup in the lungs, leading to crackles and respiratory distress. Pathophysiology. The left atrium enlarges as the heart struggles to pump blood effectively. This leads to an increase in pressure in the pulmonary veins, causing fluid to leak into the alveoli, impairing oxygen exchange. Treatment options. Diuretics like furosemide help reduce the fluid buildup. ACE inhibitors, e.g. enalapril, can lower blood pressure and reduce the workload on the heart. Aldosterone antagonists may be used to prevent fluid retention. Dietary modification. Low-sodium diet can help manage the fluid levels. Max's owner should be educated on the signs of worsening CHF, such as increased coughing or difficulty breathing, to ensure timely medical intervention. Explain the function of the autonomic nervous system and, in regulating cardiac output during stress, include the roles of both the sympathetic and parasympathetic systems. Answer. The autonomic nervous system plays a pivotal role in adjusting cardiac output during stress using two primary branches, the sympathetic and parasympathetic systems. Sympathetic nervous system SNS. During stress, the SNS is activated, leading to the release of norepinephrine. This neurotransmitter increases heart rate, positive chronotropy, and contractility, positive inotropy, thereby increasing cardiac output to deliver more oxygen to vital organs. The SNS also induces vasoconstriction, increasing systemic vascular resistance and shunting blood toward the brain and heart. Parasympathetic nervous system (PNS). The PNS, mediated by the vagus nerve, typically opposes SNS activity. It slows heart rate and decreases contractility, promoting a rest and digest state when stress subsides. During stress, the SNS dominates to support the body's fight or flight response. Once the threat passes, the PNS works to restore homeostasis. Together, these systems regulate blood flow and ensure the body's response to stress is balanced and efficient. Discuss the significance of the human-animal bond in veterinary medicine and its influence on treatment adherence. Answer. The human-animal bond is a critical component in veterinary care as it strengthens the emotional connection between pet owners and their animals. This bond significantly influences treatment adherence, as pet owners who perceive their animals as family members are more likely to follow through with recommended care plans. The bond's significance in veterinary medicine includes increased treatment compliance. Pet owners are motivated to adhere to treatment protocols because they are emotionally invested in their pet's well-being, trust, and communication. The strong bond fosters trust between the veterinary team and the owner, making it easier for the technician to communicate treatment plans and address concerns. Preventive care. Pet owners who value their pet's quality of life are more likely to schedule routine checkups and vaccinations, improving long-term health outcomes. Veterinary technicians play a vital role by understanding the human-animal bond, which can improve client education, treatment success, and overall animal health outcomes. Recognizing the emotional connection between owners and pets allows technicians to provide more compassionate care. How does the gastrointestinal anatomy of ruminants support their unique feeding habits? Include the role of each stomach compartment. Answer: ruminants have a specialized four-compartment stomach, which is essential for processing fibrous plant material through fermentation. These compartments are designed to maximize nutrient absorption from plants that are otherwise difficult to digest. Rumen, the largest compartment responsible for fermenting plant material with the help of microorganisms, breaking down cellulose into volatile fatty acids, VFAS, reticulum, works alongside the rumen to further break down food and trap larger particles, which are then regurgitated as cud for further chewing. Omasum absorbs water and some nutrients from the digested material, reducing the volume of the ingesta. Abomasum functions as the true stomach, where digestive enzymes break down proteins similar to the human stomach. This specialized anatomy allows ruminants to extract nutrients from fibrous plant material that would be indigestible for non-ruminants. The fermentation process in the rumen provides a steady supply of VFAS, which serve as a primary energy source. Describe the pathophysiology of feline lower urinary tract disease FLUT and its common causes. Answer: feline lower urinary tract disease FLUT is a term that encompasses a variety of disorders affecting the urinary bladder and urethra. The pathophysiology primarily involves inflammation of the bladder, cystitis, and may include urethral obstruction. Common causes include idiopathic cystitis, often stress-induced where the bladder wall becomes inflamed without an identifiable cause, urolithiasis, formation of urinary stones calculi that can cause pain, blockage, or irritation, urethral obstruction, common in male cats where mucus plugs or stones block the urethra, leading to an inability to urinate. Clinical signs include hematuria, blood in the urine, dysuria, painful urination, and frequent urination attempts. Treatment: anti-inflammatory drugs and pain management for cystitis. Dietary changes can prevent urolith formation. Urinary catheterization is used for obstructions. Explain the difference between bactericidal and bacteriostatic antibiotics and provide examples of each. Answer: bactericidal antibiotics kill bacteria directly, whereas bacteriostatic antibiotics inhibit bacterial growth, allowing the immune system to clear the infection. Bactericidal antibiotics. These drugs interfere with bacterial cell wall synthesis or other vital processes, leading to bacterial death. Examples include penicillin, which inhibits cell wall synthesis, and aminoglycosides, which disrupt protein synthesis. Bacteriostatic antibiotics. These drugs inhibit bacterial growth by interfering with protein synthesis or other mechanisms. Tetracyclines and macrolides are common bacteriostatic agents. The distinction is important in determining the appropriate antibiotic therapy, especially for critically ill or immunocompromised animals, where bactericidal agents may be preferred. Additionally, bacteriostatic antibiotics are often used in combination with bactericidal agents to enhance therapeutic efficacy. What is the process for performing a proper blood draw in a dog, and what are common complications? Answer: a proper blood draw in a dog begins with preparing the necessary equipment, including a sterile needle and vacutainer or syringe. The technician should also have gauze, bandages, and gloves ready. The process involves the following steps. Restrain the dog. Ensure proper restraint to avoid sudden movements. This can be achieved through manual restraint or using a muzzle if needed. Select a vein. Common sites include the cephalic, jugular, and saphenous veins. The cephalic vein is often preferred for its accessibility. Disinfect the site. Clean the skin with an antiseptic to minimize the risk of infection. Insert the needle. Once the vein is located, insert the needle at a 30 to 45 degree angle to avoid damaging the vein. Collect the blood sample. Once the needle is in the vein, draw blood gently into the syringe or vacutainer. Apply pressure. After withdrawal, apply gentle pressure with gauze to prevent hematoma formation. Common complications include hematoma formation if the needle punctures through the vein, phlebitis from improper technique, or fainting due to stress. Correct technique and monitoring are essential to minimize these risks. What are the key components of a vaccination protocol for puppies and why are they important for disease prevention? Answer: a vaccination protocol for puppies typically includes a series of vaccinations starting at 6-8 weeks of age, followed by booster shots every 3-4 weeks until 16 weeks. Common vaccines in this protocol include canine distempervirus (CDV), canine parvovirus (CPV), canine adenovirus (CAV2), rabies, administered by 1-1-6 weeks. These vaccines provide active immunity by stimulating the puppy's immune system to produce antibodies against these viruses, which are life-threatening and easily spread. Vaccination is essential for preventing common and potentially fatal diseases. It is especially crucial for puppies as their immune systems are still developing. Vaccinating puppies early ensures they have protection before exposure to these diseases. Booster vaccines also ensure long-term immunity, which is vital for a puppy's overall health throughout their life. Explain why monitoring mucous membrane color and capillary refill time (CRT) is critical in veterinary medicine. What could pale, cyanotic, or hyperemic mucous membranes indicate? Answer: monitoring mucous membrane color and CRT provides insight into a patient's circulatory and respiratory health. Normal parameters: mucous membranes should be pink and moist. CRT should be under 2 seconds. Abnormal findings: pale could indicate anemia, shock, or hypothermia. Cyanotic blue suggests hypoxia or respiratory distress, indicating insufficient oxygen delivery. Hyperemic bright red, indicates sepsis, systemic inflammation, or possible carbon monoxide poisoning. Clinical guidelines: according to the American Veterinary Medical Association (EVMA), these findings should prompt immediate diagnostic evaluation, e.g., blood work imaging, to identify the underlying cause. Describe how improper calibration of radiographic equipment can affect image quality and patient safety. Answer: improper calibration affects both image quality and safety. Image quality: overexposure leads to loss of detail due to excessive density. Underexposure results in grainy images due to insufficient X-rays. Misalignment of the beam can create artifacts and uneven exposure. Safety implications: overexposure increases radiation dose to both the patient and staff, violating ALARA as low as reasonably achievable principles. The inverse square law dictates that doubling the distance from the radiation source reduces exposure by 75%. Miscalibration can unintentionally increase exposure due to prolonged imaging times. Guidelines: regular maintenance as outlined by the National Council on Radiation Protection and Measurements (SCRP) is required to ensure safety and compliance. Compare the advantages and disadvantages of administering medications via the oral and injectable routes in veterinary patients. Answer: oral administration. Advantages: non-invasive, convenient for long-term treatment. Disadvantages: risk of aspiration pneumonia if improperly administered. Some medications are poorly absorbed due to first-pass metabolism. Injectable administration. Advantages: rapid onset, e.g., IV injections bypass absorption barriers, no first-pass effect. Disadvantages: more invasive, it requires proper restraint to avoid injury. Risk of local tissue damage, e.g., necrosis with irritants. Guidelines: the AVMA emphasizes proper technique and patient evaluation when selecting the route of administration to minimize adverse effects. Why is accurate positioning critical in radiography, and what are the consequences of rotation or misalignment in thoracic radiographs? Answer: accurate positioning ensures diagnostic quality and prevents errors. Key principles: for thoracic radiographs, the patient should be in right lateral recumbency for lateral views and dorsal recumbency for ventrodorsal (VD) views. The forelimbs must be extended cranially to avoid superimposition of scapulae over the thoracic cavity. Consequences of errors: rotation misrepresents heart size and mediastinal structures. Misalignment can obscure pathology such as pulmonary nodules or pleural effusion. Guidelines: positioning protocols from the American College of Veterinary Radiology (ACVA) must be followed for optimal results. What are the key factors that influence the choice between oral, injectable, and topical routes of medication administration in veterinary practice? Answer: oral administration. Advantages: easy to administer, well tolerated, suitable for long-term treatment. Disadvantages: slower onset of action, potential for vomiting or poor absorption due to gastrointestinal issues. Indications: chronic conditions, G. Diabetes, arthritis, maintenance therapy, injectable administration, advantages, rapid onset of action, higher bioavailability, bypasses gastrointestinal absorption, disadvantages, invasive, requires restraint, risk of injection site reactions or infection, indications, acute conditions, e.g. infections, pain management when rapid action is required. Topical administration, advantages, direct delivery to the affected area, minimal systemic absorption, non-invasive, disadvantages, may cause local irritation or allergic reactions, less effective for systemic conditions, indications, skin conditions, localized infections, flea and tick prevention. Explain the role of MRI in veterinary diagnostics and how it compares to radiography in detecting soft tissue abnormalities. Answer: MRI, magnetic resonance imaging. MRI provides high-resolution images of soft tissues, muscles, brain, ligaments, spinal cord, which is superior to radiography as X-rays only show bone and some soft tissue structures. MRI works by measuring the response of hydrogen atoms in tissues to strong magnetic fields, providing detailed cross-sectional images. MRI is particularly useful for diagnosing neurological disorders, joint injuries, and tumors. Comparison to radiography. Radiograph, best for imaging bone structures and detecting fractures, arthritis, and certain types of tumors. MRI, better suited for detecting soft tissue abnormalities, e.g. herniated discs, brain lesions, soft tissue tumors. Clinical guidelines. MRI is generally used when radiographs fail to provide sufficient diagnostic information or when a more detailed view of soft tissues is needed. Veterinary clinics should follow the specific guidelines for MRI safety as it involves strong magnetic fields. What are the key aspects of grooming and hygiene that must be maintained for hospitalized animals to promote overall well-being and prevent health complications? Answer: basic grooming, regular brushing, reduces matting, prevents hairballs in cats and promotes skin health. Nail trimming, prevents overgrowth and associated pain, which can lead to infection. Ear cleaning, prevents infections, especially in breeds prone to ear issues, e.g. flop-eared dogs. Bathing, removes dirt, parasites, and dead skin cells, reducing the risk of skin infections. Hygiene in hospitalization, maintain clean bedding and cages to prevent infection. Regular wound care for animals with surgical sites to promote healing and prevent secondary infections. Clinical guidelines. Veterinary facilities should ensure cleanliness in patient care areas according to AAHA standards to prevent the spread of disease and promote recovery. What considerations should a veterinary technician take into account when restraining an aggressive cat for examination or treatment? Answer: pre-restraint assessment, behavioral signs. Look for signs of fear, e.g. hissing, growling, or aggression, e.g. biting, scratching. Staff safety. Ensure staff is trained in safe handling practices to prevent injury. Restraint techniques. Soft restraint with a towel. Use a towel to gently wrap and secure the cat, limiting movement while avoiding injury. Use of muzzle. For highly aggressive cats, use a soft muzzle to prevent biting while maintaining their airway handling with minimal stress. Minimize forceful restraint to avoid stress-induced complications. Guidelines. The American Association of Feline Practitioners often suggests using calm handling, rewarding good behavior, and using minimal restraint to reduce stress in cats during veterinary visits. What are the key considerations when administering an intravenous medication to a patient, and how can complications be avoided? Answer: key considerations. IV site selection. Choose a vein with good blood flow to ensure medication is delivered effectively. Correct dosage. Always double-check medication type, concentration, and dosage before administration. Slow administration. Administer medication slowly to monitor the patient's response and avoid complications. Monitoring. Continuously monitor the IV site for swelling, infection, or signs of infiltration. Complication prevention. Prevent phlebitis by using proper technique and flushing the IV catheter after administration. Watch for signs of allergic reactions, especially with certain antibiotics or sedatives. Clinical guidelines. The Veterinary Medical Association advises checking for the correct IV catheter size, monitoring patient responses, and providing proper documentation for each medication administered. What are the key factors to consider when developing a nutrition plan for a hospitalized animal? Answer: species-specific requirements, dietary needs. Tailor the plan to the species, age, and health condition of the animal, e.g. puppies require higher protein for growth, while senior animals may need fewer calories. Health conditions. Modify diets based on specific conditions like kidney disease, renal diet, or diabetes, low glycemic index. Feeding methods. Oral feeding, preferable if the animal can eat, using soft or liquid diets if necessary. Tube feeding. For animals unable to eat normally, use nasogastric esophagostomy or gastrostomy tubes, intravenous or subcutaneous SQ fluids, ensure proper hydration, especially in dehydrated patients. Clinical guidelines. Follow guidelines from the American Animal Hospital Association (AHA) or Pet Nutrition Alliance for developing species-specific and condition-specific nutrition plans. Differentiate between innate and adaptive immunity, providing examples of how each responds to a bacterial infection. Why is this distinction significant in veterinary practice? Answer: innate immunity is the first line of defense, providing a rapid and non-specific response to pathogens. It includes physical barriers like the skin, chemical defenses like antimicrobial proteins, and cellular responses such as phagocytosis by neutrophils and macrophages. For example, when a dog encounters Escherichia coli, its innate immune system recognizes the pathogen through pathogen recognition receptor or immune cells, triggering inflammation and recruitment of immune cells. Adaptive immunity, by contrast, is more specific and slower, involving T and B lymphocytes. T cells recognize infected cells, while B cells produce antibodies tailored to the specific antigen. In the case of the same infection, adaptive immunity creates memory cells, which allow for a quicker response in subsequent exposures to E. coli. This distinction is crucial in veterinary practice as it influences treatment strategies. For instance, vaccines are designed to stimulate adaptive immunity, producing long-term immunity, while innate immune responses are more immediate but less specific. Understanding the roles of both systems helps veterinarians decide on the most effective treatment protocols and vaccination strategies. Explain the reporting requirements for notifiable zoonotic diseases in the United States. Include an example of a disease and the technician's role in its management. Answer: in the U.S., notifiable zoonotic diseases such as rabies must be reported to state or local health authorities immediately upon diagnosis. The Centers for Disease Control and Prevention (CDC) tracks these diseases to ensure timely responses, with surveillance helping to prevent outbreaks. For rabies, a veterinary technician's role is critical in identifying clinical signs, e.g., neurological symptoms in pets, and ensuring proper sample collection, such as brain tissue from deceased animals. Technicians also educate pet owners about rabies vaccination schedules and post-exposure prophylaxis for human contacts. They play an essential role in managing the biosecurity of suspected cases, ensuring the clinic environment is disinfected and that PPE is worn to protect both staff and clients. Rabies, being fatal and preventable, underscores the importance of strict reporting and timely intervention. The technician also assists in preparing reports that may include animal history, clinical findings, and exposure details. These efforts contribute to public health safety and help mitigate zoonotic risks. Why is antibiotic stewardship critical in veterinary medicine, and what practices should a veterinary technician adopt to mitigate antibiotic resistance? Answer: antibiotic stewardship is essential in veterinary medicine to combat the growing threat of antibiotic resistance, which occurs when bacteria evolve mechanisms to resist the effects of drugs that once killed them. Overuse or inappropriate use of antibiotics accelerates this process, making infections harder to treat. For instance, Staphylococcus aureus, when exposed to repeated courses of antibiotics, may develop resistance to methicillin, leading to more severe infections in animals. Veterinary technicians can mitigate antibiotic resistance by ensuring that antibiotics are only prescribed when necessary, following established protocols, educating clients on the importance of completing prescribed antibiotic courses even if the animal shows improvement, advocating for culture and sensitivity testing before initiating treatment, ensuring the correct antibiotic is chosen, supporting efforts to use antibiotics appropriately, such as recommending probiotics or non-antibiotic therapies when appropriate. Mrs. Patel has brought her cat Luna to your clinic. Luna recently started hunting mice around their suburban home. Mrs. Patel is concerned about zoonotic risks. What steps should you, as a veterinary technician, take to address her concerns? Answer: as a veterinary technician, addressing Mrs. Patel's concerns involves educating her about potential zoonotic risks and implementing prevention strategies. Discuss zoonotic risks. Explain that diseases like leptospirosis and toxoplasmosis can be transmitted from rodents to cats and humans. Toxoplasmosis, in particular, can cause birth defects in pregnant women. Preventive measures for Luna. Recommend that Luna be regularly vaccinated, e.g. for rabies, and done to minimize the risk of parasitic infections. Suggest using flea and tick preventatives, as these can also carry zoonotic diseases. Client hygiene. Advise Mrs. Patel to practice proper hygiene such as washing hands after handling Luna or cleaning the litter box to minimize the transmission of zoonotic diseases. Rodent control. Encourage her to implement rodent control measures around her home such as sealing entry points and using traps to reduce the likelihood of Luna encountering infected rodents. Diagnostic testing. If Luna shows any signs of illness, recommend screening for zoonotic diseases like leptospirosis, toxoplasmosis, or Bartonella. Compare and contrast live attenuated and killed vaccines. In what situations would a killed vaccine be preferred in veterinary practice? Answer: live attenuated vaccines contain weakened forms of pathogens that elicit a robust immune response, providing long-lasting immunity with a single dose. An example is the canine distemper vaccine. However, they may pose risks to immunocompromised animals as they contain live pathogens that could cause disease. Killed vaccines, in contrast, contain inactivated pathogens or components that are unable to cause disease but can still trigger an immune response. An example is the rabies vaccine. These vaccines generally require multiple doses to achieve full immunity but are safer for animals with weakened immune systems or pregnant females. In veterinary practice, killed vaccines are preferred when the animal is immunocompromised, e.g., due to illness or treatment like chemotherapy. There is a risk of reversion to virulence, as seen with live vaccines. The animal is pregnant and there's a risk that live pathogens could affect the fetus. Killed vaccines, though generally less effective in terms of immunity duration, are crucial for high-risk populations and are safer in certain clinical situations. What biosecurity measures should a veterinary clinic implement to prevent the spread of zoonotic diseases? Answer: biosecurity measures in veterinary clinics are essential for preventing the transmission of zoonotic diseases. Key practices include isolation protocols. Suspected cases of zoonotic diseases should be isolated in separate examination rooms or areas to prevent cross-contamination with other animals. Personal protective equipment, PPE. Veterinary staff should wear appropriate PPE, such as gloves, masks, and gowns, when handling potentially infected animals to prevent zoonotic transmission. Cleaning and disinfection. All surfaces, equipment, and examination tables should be cleaned and disinfected with EPA-approved disinfectants, especially after handling animals with suspected zoonotic infections. Waste disposal. Animal waste should be disposed of following OSHA guidelines to avoid contamination. This includes proper handling of feces, urine, and contaminated bedding. Client education. Educate clients on how zoonotic diseases are transmitted and the importance of hygiene practices like hand washing after handling animals or cleaning litter boxes. Why is proper aseptic technique critical in bacterial culture preparation, and what steps must be taken to ensure contamination-free results? Answer: proper aseptic technique is critical in bacterial culture preparation to avoid contamination that can lead to inaccurate or unreliable results. Contaminated cultures may result in mixed infections, incorrect diagnosis, and inappropriate treatment. Key steps include sterilizing equipment. All tools, such as inoculation loops, needles, and petri dishes, should be sterilized using an autoclave or appropriate disinfectants before use, maintaining a sterile field. Cultures should be prepared in a sterile environment, e.g., a laminar flow hood or sterile workbench. All surfaces must be disinfected before use. Flame sterilization. Tools, such as inoculating loops, should be flamed before and after use to eliminate any microbial contamination. Wearing PPE. Technicians should wear gloves and lab coats to minimize contamination from external sources. Handling samples properly. Always handle samples with sterile instruments and avoid direct contact with non-sterile surfaces. Following these steps ensures that cultures are uncontaminated and accurate, providing reliable diagnostic information for proper treatment. How does a hypersensitivity reaction differ from an autoimmune disorder? Provide an example of each in veterinary medicine. Answer: hypersensitivity reactions involve an exaggerated immune response to harmless antigens. There are 4 types of hypersensitivity, with type I being the most common in veterinary practice. An example is flea allergy dermatitis in dogs, where the immune system overreacts to flea saliva, causing itching, redness, and inflammation. Autoimmune disorders occur when the immune system mistakenly attacks the body's own tissues. An example is systemic lupus erythematosus, SLE, in dogs, where the immune system targets healthy cells and tissues, leading to inflammation, joint pain, and organ damage. The primary difference is that hypersensitivity is an exaggerated response to external antigens, while autoimmune disorders involve the immune system attacking the body itself. Discuss the modes of transmission for zoonotic diseases and the role of veterinary technicians in preventing their spread. Answer: Zoonotic diseases can be transmitted via direct contact, indirect contact, vector-borne transmission, and airborne transmission. Direct contact involves contact with infected animal fluids or tissues, such as handling an animal with rabies. Indirect contact involves contaminated surfaces or objects, like a shared kennel where multiple animals might contract diseases like parvovirus. Vector-borne transmission occurs when insects like ticks or mosquitoes spread diseases like Lyme disease or West Nile virus. Airborne transmission involves pathogens that can be inhaled, such as tuberculosis. Veterinary technicians play a crucial role in preventing the spread of zoonotic diseases by educating clients on proper hygiene and vaccination protocols, using PPE when handling animals with known or suspected zoonotic diseases, ensuring proper sanitation of equipment and clinic areas, reporting cases of notifiable zoonotic diseases to appropriate authorities to contain potential outbreaks. What diagnostic tools are used to identify bacterial infections in animals, and how does the choice of tool influence treatment decisions? Answer: the primary diagnostic tools for identifying bacterial infections in animals include culture and sensitivity testing. This involves growing bacteria from samples like urine or blood and testing their susceptibility to various antibiotics. It helps identify the specific bacteria causing the infection and determine the most effective treatment. PCR, polymerase chain reaction. PCR detects bacterial DNA, allowing for quicker identification of pathogens, especially those that are difficult to culture. Blood smears and cytology. These tools can provide immediate results for certain bacterial infections by directly examining infected tissue or blood. Serology. This test detects antibodies or antigens associated with specific bacterial infections, aiding in diagnosing conditions like Lyme disease. The choice of diagnostic tool influences treatment by ensuring that the correct antibiotic is prescribed, minimizing the risk of resistance and optimizing treatment outcomes. For example, culture and sensitivity testing ensures targeted antibiotic therapy, while PCR may speed up diagnosis in critical cases.